So we'll move right now to the beginning of some learning. So I think Mark Thimke is going to facilitate this session along with Jim Zellmer and Mimi Johnson with Wisconsin DNR and Dr. Curtis Hedman with our Department of Health Services. So we'll need whoever is going to present to be up here, and I'll get that presentation teed up in just a second. Don't ask why the least qualified person is attempting to run the technology this morning.
Well, we're getting started with the presentations. Just want to introduce the panel and talk a little bit, echo some of the, at least the theme that Secretary Payne expressed today on public-private partnerships. Let me get this on.
A little closer.
Oh, a little closer. All right. In my prior life, I was one of those lawyers who loved PCBs because it helped put about 4 kids through college, as my wife said. But during that experience, I had the real pleasure to work with Secretary Payne on the Sheboygan River and Harbor project with PCBs, and that learning from that wonderful project where we collaborated closely to do a major project, avoided all of the litigation that occurs with these kind of cleanups, and we worked collaboratively on a public-private partnership to get that work done. And that's going to be key for dealing with PFAS as we go forward. All of you in communities need to foster that kind of trust and relationship with those who may have been affected by PFAS, those who may have used PFAS, those who may have some responsibility for PFAS, to work together to try and find common solutions and get things done. And I think there are many examples where that has occurred. Sheboygan is one of the key, and I really take that message to heart that will come out of that to foster those kind of relationships. We have with us today to help kick off the discussion of learning, which is very important, 3 really key people at the state who are working diligently and very hard on addressing PFAS, learning help about PFAS, and helping to move these programs forward. We have Jim Zellmer, Mimi Johnson, and Curtis Hedman. Jim and Mimi are from the Department of Natural Resources and Curtis from the Department of Health Services. I worked closely. Jim and I have a little gray hair in parts because we've worked together a very long time. We probably gave each other those gray hairs from our prior work, but we may have disagreed, but we always laughed. And those are the kind of relationships which are key in working on these things. So it's a real pleasure to have Jim here as the Division Administrator for Environmental Management. Mimi and I have recently started working together on the PFAS External Advisory Group, where we are addressing PFAS issues and helping to formulate policy for the state. And Mimi, in her role as the Director of the Office of Emerging Contaminants, comes to us via DC, all that wonderful warm weather, and she comes to Wisconsin. But we're welcome to have her, and she comes with a health background and working with the department. And obviously the health issues are very important with respect to this, and we have Curtis Hedman from the Department of Health Services, a toxicologist who works on environmental toxicology. In my career, I worked with a number of people from the Department of Health, and they were extremely helpful in communicating with communities, with people who were affected, to get them the message and the information they need, and they're a key part of the program. So we're going to hear from them today, and the kickoff speaker of you is going to be Curtis. Yeah. You get number 1. Thank you.
Just a quick note for folks who ask questions later throughout the day. If you have questions for panelists, what we're going to ask is that folks come up and use this microphone for questions. That way Wisconsin Eye and our other broadcasters can cover that. So that you'll have to take a long walk if you're on that end of the room, but we know we can all do it. Thank you, Curtis.
Thank you.
Just need to get that close.
All right.
And you'll have to use the space bar to advance.
Thank you.
Yeah, it's my pleasure to be here today to speak with you about PFAS in Wisconsin, and in particular, some of the health-related impacts for PFAS as a learning tool. And for today's presentation, the main themes are going to be what are PFAS and why do we care about them? Where are they in the state and what are we doing about it? That'll be my DNR colleagues following up. And what more can we do as a state? And I think that conversation is going to carry throughout the rest of the day. So to start, what are these PFAS chemicals? The term is per- and polyfluoroalkyl substances, and these are a family of human-made chemicals that have very nice properties as chemicals and very great in products, but on the flip side of that, they are very, very persistent in the environment and have some impacts to human health. This is a picture of the USS Forrestal incident. It was a U.S. aircraft carrier that had a major fire in 1967. Well over 100 sailors died, and I believe another 150 were injured. And this sparked the U.S. Navy to really look at their preparedness for these types of incidents. And it came to light that there was a really great group of chemicals in production, and they were developing the AFFF. This U.S. Navy invested heavily in AFFF, and then other branches of the military followed. So it ended up on many bases throughout the country. Then commercial airports also went in on this AFFF, but then as you got into the 1960s and 70s, you also had a proliferation of products because commercial entities were realizing the great properties of these chemicals as surfactants, as stain-resistant compounds, and they were being put into a large number of consumer products, food contact packaging, consumer makeup, of course, the water-resistant clothing and furniture and carpet treatments, and the firefighting foams continue to proliferate into commercial products such as fire extinguishers. So we have this emergence timeline. You had the synthesis and development in the 1930s and 40s. Then you had the first commercial products showing up in the 50s and the 60s, really taking off in the 70s and 80s. And during that 1970s and 80s timeframe, you also had emerging health concerns, mainly in the occupational health arena. The workers that were working with these compounds were coming down with some ailments, and started looking at the blood of these workers. Then we get to about the year 2000, and there was starting to become a little bit of concern for the environmental effects also. And at the same time, we had a takeoff in the emerging technologies to be able to analyze for these compounds. And we also had a takeoff in the toxicological studies and epidemiological studies for PFAS. So you had all these things converging, and I believe it was 2002, EPA asked the major producers of the two main PFAS chemicals, PFOS and PFOA, to voluntarily discontinue their production. And then you had these phase-outs of those two main compounds. But then commercial entities were looking to find alternatives, chemical alternatives to PFOS and PFOA. And then you got to about 2010, we had the C8 study, which was the DuPont, Ohio, and West Virginia. The communities that were affected by that, there was a large lawsuit that was settled, and instead of taking payout as a community, the community reinvested that settlement into epidemiological studies. And that really helped us to better understand the human health impacts of these chemicals. You get to about the mid 2015, 2016, EPA was looking to get a health advisory level for PFOS and PFOA, and you probably noticed those come out. That was the 70 part per trillion. And then a lot of the states were starting to look at these as a class of chemicals, and Wisconsin developed proposed groundwater standards for a number of these in the 2018-2019 timeframe. And that brings us up to date. We have a lot more activity at EPA in the states. And this is a depiction of the early initial attention was on PFOS and PFOA, and with EPA's unregulated contaminant monitoring rule number 3, they added several other perfluoro compounds. And then as you got through 2015 to 2020, we had these additional analytes. And for those of you that are seeing lab reports, you're seeing those top 3 tier compounds in your reports. There's been more recent attention on the novel replacement chemicals. These are the fluorotelomere alcohols, the perfluoroethyl ether acids, and the perfluoroalkyl ether acids. But as a class, PFAS constitute, I've seen estimates of 5,000 to 10,000 total compounds, and that depends on whether you consider the salts, the sodium and potassium salts as individual compounds, but it's a very large category of chemicals. So we are still well into the research and development on these as a class. So very quickly, I just want to look at when you see all these different PFNA, PFBA, what you're looking at is the carbons, the number of carbons in the chain. And the carbon-fluorine bond is one of the strongest in nature. And then you have, at the end, you're going to have a functional group, either a carboxylic acid or a sulfonic acid. So for perfluorooctanoic acid, that's the 8-carbon chain. And you have a carboxylic acid functional group. For perfluorooctane sulfonate, or PFAS, it's again the 8-carbon chain length, but you have the sulfonic acid functional group. So depending on what you have, PFBA, PF butyric, PFNA, PF nonanoic, and hopefully that helps you to look at those codes in your report. Now looking at why do we care in terms of health impacts. PFAS chemicals do not leave the human body readily, and they're distributed mainly in the blood, serum, and through the liver. When you try to metabolize the PFAS, it gets actually reabsorbed in the kidney and the tubules from the bile and goes back into the blood. And because of that recirculation, some of the longer chain perfluorocompounds have half-lives for individuals from 1 to several years. So it's going to get out of your body, but it's going to take some time. And in addition, for our work as risk assessors, we're concerned because these chemicals are seen to cross the placenta and are detected in breast milk. So we certainly have to consider neonatal exposure and exposure to infants, and to make sure that our health advisory levels are protective of those sensitive populations. This conceptual model is adapted from Ole and his colleagues. It originally came out in 2013, and I really think it does a good job of looking at the universe of exposures in this conceptual model. If you look starting at the left upper, you have the PFAS producing and using industry, creating effluents, solid waste, and air emissions. On the right side, you have the aqueous film-forming foams, the firefighting foams in use at a lot of airports and military institutions. And those are also causing inputs to the environment. You follow both ends down to the bottom, and you have impacts to groundwater and surface water. And those can affect certainly biota. You were just hearing about biosolids applications to farmlands, But you also have water going through treatment plants, and then you have leachates with PFAS. Then you start to see, as you get into that family in the center, you start to see all the inputs to exposure. And you have certainly all the consumer products that we're concerned with, the use of those food packaging, the dust exposure in the home, et cetera. But when you have an impacted groundwater source, the reason we're so interested in that is that people drink 1 to 2 liters of water per day. So when you have an impacted water source, that really starts to increase the amounts of PFAS in the body. That's why we want to identify those exposure pathways and eliminate them as quickly as possible. In terms of health effects or associated health effects, we have potential for increased cholesterol, reduced antibody response, the immunotoxicity, decreased fertility in women. And we also have increased risk for thyroid disease, osteoarthritis, ulcerative colitis, and testicular and kidney cancers. So a wide variety of effects. But important to note that unlike PCBs and other large classes of compounds, not all the PFAS are the same in terms of their associated health effect. So that makes anticipating the risk of mixtures very difficult. So we are engaged with making sure that the population of Wisconsin understands the health risks and also identifying those potential exposures and working to eliminate them as quickly as possible. And that is the end of my portion. I will hand it over to Mimi Johnson from DNR. And we will be here throughout the day. I have a couple of colleagues with me today, so please feel free to approach if you have additional questions. Thank you.
Great, thank you, Curtis. I'm going to walk through a bit more about how and where PFAS are showing up in Wisconsin and what we're currently doing about it. We know PFAS are forever chemicals, as we've heard about already this morning, and that they don't naturally break down, and they're continuously moving throughout the environment and our ground, air, and water. So this graphic here is from our neighbors in Michigan. It just helps illustrate how once PFAS are in our water, they continue to cycle through our environment. There's some specific instances where we might know or can track down the use of PFAS-containing products like firefighting foam. There's also discharges from industrial use directly to surface water, to wastewater, consumer product goods and waste, leachate and biosolids, and plant uptake. In some instances, it might be easy to figure out where that source or multiple sources might be, and in others, it can be very, very difficult to track it down. Recognizing this pervasive, forever nature of PFAS, the EPA strategic roadmap as well as the WSPAC action plan both focused on prevention and trying to break that life cycle. So one of the tools that we've developed in Wisconsin and at the DNR, just last year in October, we launched an interactive PFAS data viewer. We recognized the importance of building a simplified and interactive tool for users to help navigate the different databases that we do have out there and the information we have about PFAS in Wisconsin. The tool can be found on our website. If you just search for PFAS on DNR's homepage, it's one of the primary things that pops up for you. And it compiles information about PFAS in Wisconsin in our water, land, fish, and wildlife. It pulls from different databases, including our remediation and redevelopment tracking system, which is a comprehensive database about contaminated properties and other cleanup and redevelopment sites and activities in Wisconsin. And the PFAS listings in there include those with confirmed PFAS contamination, and there's just about 80 unique locations in that database for PFAS. It also pulls from our drinking water database, or drinking water system portal, which includes information about our public water systems in Wisconsin. They're systems that provide water for human consumption, and they're regulated under the Safe Drinking Water Act. And we have information from both our voluntary project last year as well as the work that's underway with the new drinking water standards. And then we also have information from our Fish, Wildlife, and Parks Division related to our consumption advisories out there and our Surface Water Integrated Monitoring System, or SWIMS, which has information about the different sampling that we've done on our lakes and rivers across the state. So what are some of the things that we're doing here in Wisconsin right now? As we heard this morning, Governor Evers issued an executive order back in 2019 that kicked off the Wisconsin PFAS Action Council, which is a coordinating body of about 20 state agencies. And WISPAC issued a series of recommendations back in 2020 that's our PFAS roadmap. And among these actions were the need for standards, sampling, stakeholder engagement, and communication, among many others. So some of the regulations we have in place, we heard this morning, we've got some PFAS-specific rules related to drinking water standards and surface water standards for PFOA and PFOS. We also have a PFAS firefighting foam rule that regulates the safe containment, treatment, and disposal of PFAS foam if it's used in the case of emergency or testing. We've also have mentioned some of the inputs in the viewer and other ways that we're studying and understanding how PFAS is showing up through sampling. Our drinking water and surface water standards both have required components for monitoring. With drinking water, that means that we'll have information from about 1,900 systems in the state that will be routinely sampling for PFOA and PFOS. And our surface water rule incorporates monitoring for PFOA and PFOS into our WPDES permits. Programs across our agency are also conducting additional sampling, looking at different media, looking to understand what we might consider the background level. As we heard, all of us have PFAS in our body. It's not naturally occurring, so we're trying to figure out what that base level might be across the environment. We also work in coordination with our Department of Health Services partners to gather information and assess in fish and wildlife as well as drinking water whether there might be health advisories or consumption advisories that are warranted. We've issued approximately 20 PFAS-specific fish consumption advisories, and we work with the Department of Health Services around whether it might be a well-by-well advisory or a system-wide or community-wide advisory for drinking water. And sometimes advisories are warranted or required in order to tap into some of the state services and resources that we've heard about as well. And then throughout the day, we're going to hear from my colleagues at the department about some of the resources available, both in terms of funding and technical assistance. But we have hundreds of millions of dollars, as we heard, made available through bipartisan infrastructure law for drinking water and wastewater infrastructure projects, as well as DNR staff available to help review proposals and options related to upgrades or technology that's needed. I'm also not going to steal the thunder of some of our guests who are here today from different communities who have been impacted, but we'll hear directly from them. But just as a preview, we have communities out there engaging with their residents, working to educate and engage through listening sessions, additional sampling, technical assistance, and intergovernmental coordination. We're also continuing to explore options for safe water, whether in-home or system-wide, and exploring ways to continue to mitigate further contamination. And one in particular in town of Campbell, they've really worked to understand how they can handle the waste that comes from treating the water through a very unique pilot project. And this, just again, to reinforce that we've got our bipartisan infrastructure law funding out there. The presence of PFAS makes folks eligible to access these great expanded financial programs. And some of the public infrastructure projects to date have included upgrading treatment system, establishing public water systems, or connecting additional residents to public water, or building new wells. So really some great opportunities out there. Now I'm going to turn it over to Jim Zellmer, who's going to talk a little bit more about what else we can be doing.
Thank you, Mimi. So what else can we be doing? We heard the Secretary talk about EPA. EPA is doing a lot of work on the national level, but we also have a lot of work that we need to be doing here in the state. EPA doesn't set groundwater standards. We heard we have surface water standards and public drinking water standards for PFAS. The state, it's up to the state to set groundwater standards. We made an attempt. We were unsuccessful, but we're starting that process again. So we're working on groundwater standards. We continue to expand our sampling efforts. Hopefully we'll get some additional money in the budget to help us expand those sampling efforts. That's everything from our surface waters. We feel like we're getting a pretty good handle on background concentrations in our surface waters across the state. We just completed a groundwater study. We'll continue to look at targeted started research near either known or probable contamination, PFAS contamination sources. Mimi had talked about our public water systems. They will complete sampling by the end of the year, so we'll have a pretty good understanding of communities that are dealing with PFAS. Mimi also talked about the fish. We continue to collect fish from around the state and have those processed and determine if additional consumption advisories need to be made to make sure that people are informed when you're out. We want you to be out fishing, but we want you also to be informed on the relative health. Other things that we'll do, as the Secretary said, we're going to be assisting communities, facilities and communities that are affected by this. When you call us, we will talk to you about these are the services that we can provide, and this is what we can bring to bear to help you. We have the community toolkit that just went live this morning. We have hard copies here. Also, there are, you'll be able to access it online, so please take a look at that. Mitigation. Unfortunately, in a lot of areas, we heard about some of the legacy PFAS that we have out there. We have over 100 active groundwater investigations dealing with PFAS across the state, so we need to work on mitigating those issues. We work to identify if there is a party that's responsible for the contamination, and then work with them to make sure that they fulfill their obligation to investigate and remediate the situation. As we've heard, it's extremely difficult to remove PFAS once it's in our environment. It's one thing for drinking water. Wausau talked about installing treatment with anion exchange and granular activated carbon, but on the wastewater side, and we'll hear Madison talk about that, extremely difficult once it's in our system to get that removed. So really we need to focus on source reduction, what we can do for source reduction. And again, along that line, really what we can do to prevent that from ever entering our systems. EPA is working. One of the things is we need to know what industries are dealing with PFAS. EPA's expanding their reporting requirements. As we know, a little bit of PFAS goes a long way. So under the federal reporting requirements, historically, companies didn't have to report the PFAS that they were using in their manufacturing and products. But now that EPA is tightening that up, so they'll have to do that. It's very encouraging to see that a number of industries are moving away from PFAS. We have a commitment from the paper industry to be PFAS-free by the end of 2023. That's very encouraging. I don't know what they'll do with our greasy hamburgers when we eat those, how we'll keep that grease off our hands, but that's very encouraging. 3M announced recently, 3M, obviously one of the big producers of PFAS, they announced recently that they are going to end production of PFAS by the end of 2025 and also end the use of PFAS in any of their products by that time. What else can be done? Several of the states have passed legislation preventing sale of products containing PFAS in their states. There's about a dozen or so states that are doing that. Minnesota is just working through that right now. So, that's just yet another step that can be taken. As far as communities, what can you all do? Number one is, a little closer, I'm sorry. Number one is prepare yourself. Attend conferences like this, talk to your neighbors and learn more about PFAS. Get to know your local public health department, your water utility, your emergency management group. So when it does hit your community, and it may, that you have a network that you've already established to work through that. Know where your community gets their drinking water. We have a number, the Secretary talked about the number of systems that we have on groundwater. Know where your wells are, and we have a number of communities that have source water protection, really protecting that recharge area to prevent PFAS sources from getting into your wells. And then I guess the big thing is to have a plan. Work together, again, talk to your colleagues. You're going to be hearing about different experiences from communities that have encountered this. Really learn from them today, engage them, get their contact information so if it does hit your community, you have a contact that you can call. You're going to be hearing this afternoon about additional funding sources. Be aware of that. We're fortunate the Secretary talked about the governor had included additional money, another $10 million in the American Rescue Plan for well compensation to replace private wells. Also, we have hundreds of millions of dollars in the bipartisan infrastructure law that's going to be available over the upcoming years. So now is the time to act. The money is available. Sorry, Fred. The money is available, and now is the time to act on that. And with that, Mark, I'll turn it back over to you for questions.
Thank you, Jim. And we have about 10 minutes available for questions on the schedule. The process would be to have people come up and ask it there.
Yeah, please, if you have a question, just come on up, and we'd ask everyone, because of the nature of these mics, just hold the mic when you're speaking.
And while you're thinking of the question, I'll ask one to get us started. Deep breath. No, easy. Okay. So for communities, I think there's a lot of confusion out there. We currently have in Wisconsin a 70 part per trillion value for PFOA, PFOS. We have the federal government coming out with MCLs with different numbers for more compounds. How do communities react to all of this? How do you see this coming? And in particular, if EPA does act, and we have one standard in Wisconsin and EPA has another standard, how should communities be reacting?
Right. Curtis, do you want to take what do you want? Sure.
And we have as mentioned, 70 part per trillion that's currently in effect. And
The mic is on.
I don't know if it's on or it's
see if we can.
fairly hard to hear. I don't know. Technical issues.
Yeah.
Or maybe we need to use the one up there.
Let's try it now.
No, that's not really on. We'll go up there.
Okay, I guess you'll have to go up there and wait.
Yeah.
Tech person.
And we've been operating under the 70 part per trillion, but at affected sites that remediation and redevelopment is working on, they recognize Wisconsin DHS's recommended groundwater standards and are using those levels for the 18 PFAS compounds. And our group at DHS, as well as the DNR staff, are reviewing the current proposed MCL information from EPA. We're watching that closely, and the public comment period for those is done, I believe, May 30th, and we look forward to that process moving forward. Would you have some additional comments?
Thank you very much, Curtis. And we rely heavily on our health professionals at Department of Health Services to inform us on what is that safe level. And that's, Mark's question. Really the key, I think, and what we're seeing here is that the health science is continuing to evolve. EPA back in, say, 2009, they started out with a health advisory of a couple hundred parts per trillion. 2016, they dropped that to 70. And then more recently, they dropped that to the parts per quadrillion as far as a health level. So that science continues to evolve. Again, Department of Health Services, our toxicologists over there continue to review that information and advise us on what that is. But as Mark had said, it can cause some confusion to say what number is safe. Really what people want to know is what number is safe. What we do know is the lower exposure, the better. So obviously no detect is the best, but we want to try to keep those concentration as low as possible. So thank you. Mark?
You have a question? We have one question. Tom?
So I live near a community, town of Stella in Oneida County, that has a real soup of PFAS. And I was wondering, how you assess both the past impact and whether it's safe to drink of the water when you have different varieties of PFAS all mixed together. You alluded a little bit to it in your comments, but maybe elaborate a little bit more.
Thanks, Jim. No, I appreciate your bringing that up because it brings up another aspect of our recommended groundwater standards, and it's that we have numbers for the 18. We have a combined standard of 20 part per trillion for 6 of those components, but then overall we're looking at what's called a hazard index approach to mixtures of chemicals, and that allows us to take each individual compound and divide its amount by its recommended health-based value to get a ratio, add those ratios together. And if that gets you above 1.0, then that's a level that we would like you to see, you take action and maybe have an alternative source of drinking water. That is an approach that EPA is recommending in their current MCL language, so it's great to see them also looking at a hazard index approach to the mixtures issue. Thank you.
Hello, Fred Schaefer from the town of Ravon. I just want to thank the DNR. Secretary Payne, thank you so much. We had a problem with PFAS, and DNR was instrumental in getting our PFAS remediation system up and running. We have a temporary system up. It was the first in Wisconsin, by the way. But that being said, we're real concerned about the science, about the epidemiology behind PFAS, because we just talked about the health effects. 70 parts per trillion, 4 parts per trillion, 4 parts per quadrillion. Don't exactly know what that is, but it seems like all the studies, as was mentioned before, based on the C8 studies, which were produced in litigation by one party in that litigation, so they're suspect from the get-go. So, and then there's modeling based on those C8 studies that sort of we're looking at, and that's all the community has to go on at this point. But there's been a lot of testing. So are there new studies out there that are going to look at those communities that showed high levels, or not high levels, but that sweet spot, less than 70, less than 100, but something more around the 4 to see what those health effects are? Because I know you're talking about we don't know what they are. We only have the C8 studies. Is there anything out there that there are studies going on right now that we can then back up and look at?
Yeah. Another excellent question, and the ATSDR funds our program in Wisconsin, and they're also undertaking some national scale epidemiological studies at some of the higher impacted sites throughout the country. One of those in particular is called the PEAS study. It's a community in New Jersey that's highly affected. They're in the process of creating a report for that study that I think started in 2019. So it's promising that we have some more human health epidemiological studies coming out. One of our handouts, if you see our DHS resources on the table, is from ATSDR and has some information, more detailed info about those epi studies. So I'm really glad you brought that up.
We have time for one more question.
Okay, I come from France, so sometimes I really think outside the box, and my questions seem to be really far out. You know what they say about when you are in a hole, you start by just stop digging? My question is, all the remedies that we can find, that would be really, really great. But how about just stopping it? Just no more. Ban all of these products. You first need to start by banning them, because if they keep on piling the PFAS in your water while you're trying to filter it, you're not getting ahead. So, that's it. Thank you.
Yeah, thank you. As I had mentioned, there's a number of states that are currently doing that. like I said, I think there's a dozen or so states that are banning PFAS-containing products, and that really is the key, because if you ban them, they're not going to end up in our environment. Also, Congress had mandated that Department of Defense move to a fluorine-free foam by October of next year. They're working towards that as well. The problem is, and what states are running into, is that until they can find a substitute sometime for some of these products, they're saying, what else are we going to do? So we'll have to balance that. But yeah, a number of the states are currently doing that, banning the products. Yeah.
I want to thank questions, thank all of the members of the panel. I think it illustrates that we have many, many questions on this topic that are being raised, that we need to continue to work together on solutions and answers and continue that process of dialogue. This is not going to be solved tomorrow. This is going to take years for us to solve and to get questions answered, and we all need to be patient with each other and work together to try and find creative and cooperative solutions. So thank you again to all of our panel members this morning.